another facility, and my hairline was straight across, completely not natural. As you can probably see, it's very row-like up top, and in the back of my head I have a scar. It looks like that right now, completely bald, and I just thought that was a natural byproduct of the surgery. My brother, he was here about a month ago to get the surgery done for the first time, and I came to the office to watch him get his sutures removed. The thing that I noticed immediately was the day the stitches came out, there was no scar on the back of the head. It was almost as if the surgery didn't even happen. At that point is when I realized that my previous surgery was a completely botched job. Another big difference I noticed in my previous surgery, I was bleeding out of the back of my head where the grafts were removed for 3 to 4 days after the surgery. Every morning I'd wake up and my pillow would be bloody. With my brother, the next morning there was nothing there. And obviously I'm not a doctor, I don't know the difference in the procedures, but whatever was done, it was done a lot better through Dr. Bolton than it was the way that I had it done previously.
Okay, we just got through harvesting the donor, and we completely excised the old suture site that was there. So that way when you lift up the hair, you can see where we harvested the donor from. That's going to be the new suture line. And this is where the old suture line was, where the old scar was. And we just removed the whole scar. So that's going to be the new suture line in there. As you can see, the hair meets with the hair. And then when you brush it down, it comes down.
This is Josh, 10 days after my surgery. I'm feeling great, as you can tell from the smile on my face. Dr. Bolton not only met, but he exceeded my expectations. And the most important thing I noticed was when I woke up after my first night of sleep, my pillow wasn't full of blood. Not one drop of blood in my pillow, no bleeding at all. Doctor did a great job with the suture line, cauterizing everything up so there was no bleeding. Last time I bled for 3 days after the surgery.
Hi there, we're doing a follow-up visit with the patient that's at about 4.5 months. We just want to show you the initial progress and how well the suture line is healing. So if you take a look here, we did a max size case, which means we moved as much hair as we possibly can move. We harvested them in this permanent area all the way, the entire way around. So if you look over here, this is where the suture line is. So let's take a look at that. This particular patient cuts his hair with what looks like a 2-blade. So this is where it starts, the suture line starts. This is the suture line right here that you're looking at, this fine trace line. The great thing about this is going to continue to heal for the next year. So this is still healing, believe it or not. So this is where it is at about 4.5 months, and we have plenty more time for this to continue to heal. So this is the suture line right here. So this little tiny line right here, that's the suture line. A lot of patients are very concerned about suture lines, and they seek out follicular extraction because they're afraid to wear their hair short. But as you can see, suture line, if it's done properly and the patient follows instructions, it should be undetectable, just the way this is. And this is still not even done healing. Now if you take a look at this, we could create the same type of look right above that. If you look above here, we can create that same look, just like that. So it just looks like a normal, this is a normal crease in the hair. And let's look below at the suture line. So it just basically looks like a normal little crease in the hair. And we continue around, and this is the suture line all the way up to here. And that's how we got all the hair for him. And then this is going to continue to heal once again for the next year. And that's it. Turn your light on. This is perfect. Good. Man, you could probably shave your head even with like a 1-blade and you wouldn't even be able to see it. What do you use, a 2?
Yeah,
I think 2?
Yeah.
Okay, so we're with the patient who is currently now 4 months out post-op, and we're just going to take a look at the suture line to see how the suture line is doing. And so here is the suture line. So as you can see, it's completely undetectable, and this is going to continue to heal throughout the year. And then once we get past as it heals, then the rest of the hairs will come in, and it'll be completely undetectable. It's like completely undetectable.
And this is a maximum size
This is a
session,
max
Doc. You
size
took out as
session.
many hairs as
And
you
this is
possibly
at-
could.
And this is at 4 months of the healing stage. So this is where the suture line is. Okay, we're with the patient that had a procedure exactly 10 days ago. He's here for the suture removal. He had a procedure at another facility prior to this where they left him with a little bit wider of a scar. We left that alone for this particular procedure because we wanted to get him some more density because he had a little bit of a limited result from that first procedure. So we went above it to get the most amount of hair we can possibly get for him. So 10 days out, the stitches are in. This is how it looks with the stitches still in. We're going to take them out in just a minute. But as you can see, at 10 days, it already completely covers. The hair meets with the hair. If you take a look over here, this is what the old suture line looked like from before. They left him with a wider scar. This is the work that was done in another clinic. If you look at above us, we went right above that. This is our suture line at the 10-day mark. And this is before it's even completely healed, so this will be completely undetectable once it heals. So this little line in the middle will be the new suture line. The dots above and below are where the stitch goes in and out, and that will heal over the next few days. We just removed the patient's sutures, and we showed you how it looked prior to the removal. Now we're going to show you how it looks immediately after. This is going to be the new suture line right down in the center. As we talked about, those eyelets are going to heal over in the next couple days and be undetectable. So the suture line itself is going to be this very traced little line running through here, and then the hair is going to grow above and below it, so it's going to be completely undetectable as it grows out. This is what he had from another clinic. This is the old line that he had from another clinic. So obviously if you don't take the time or the care, you can get a wider suture line. But if you follow your instructions, you take your time when you close it, you'll see that the suture line should be completely undetectable.
Okay.
You see it?
Can't find it.
The suture line is the little tiny line here. The hair meets above and below. These sutures are going to come out momentarily, and then this will be undetectable. Now these little eyelets above and below will heal over the next few days, so they'll be completely undetectable. And if you follow him around, you can see how nicely he healed and how undetectable this is at the 10-day mark. So here we are with our patient who's here for a 4-month follow-up. He had his max-size surgery 4 months ago, and what we're going to do is show you how the suture line looks so far at the 4-month point. So basically, we harvested him all the way from over here. So this is the beginning of the suture line right here. And this is the suture line. If you can see this area here, this is the suture line right there. As you can see, it's completely undetectable. If you don't know what you're looking for, you would never be able to find this. So this would be the suture line right through here.
You know what I think would be really interesting, Doc,
Okay.
is showing the scar
Okay.
and then showing a crease right above it, which would look identical to the scar, meaning that the crease and the scar look the same.
Okay.
I think
So
that'd be a great illustration,
this is the scar.
right?
Okay. And then I can make that same appearance right,
Right.
here.
Okay, that's just a normal
This
crease.
is just normal crease in the hair.
Right.
That's
So
exactly-
actually, the crease and the
So-
scar are pretty
They-
similar,
Exactly.
identical.
Exactly.
Excellent.
So if you don't know what you're looking for, this is undetectable. If you do know what you're looking for, it's virtually undetectable. I'm having a hard time finding myself.
If any one of my friends or anyone on the street asked me which doctor to go to, I would 100% endorse Dr. Bolton and recommend him to anyone else. I'm a good judge of that because I've been to 2 separate doctors and I've seen the procedures night and day.
I would specifically recommend Dr. Bolton to others, largely because of what he's been able to do all in one procedure. And when I looked at what other doctors were proposing to do, because I shopped this around, it would have taken at least 2 procedures from anybody else, at accordingly double the cost to do that.
I would definitely recommend Dr. Bolton to anyone considering getting a hair transplant.
I would definitely recommend Dr. Bolton to others.
I will recommend Dr. Bolton to anyone.
I would recommend Dr. Bolton.
I would recommend Dr. Bolton to everybody.
Dr. Bolton and his staff are wonderful.
So you're happy?
Yeah, I'm very happy.
Excellent. Thanks very much.